how is it possible that a system designed to help Americans afford health care is now shoveling billions of your tax dollars to fraudsters? And at the same time, enriching some of the biggest insurance companies in the country?
Welcome back to the Deep Dive. Today, we're digging into a stack of sources you sent us about the financial integrity, or maybe the lack thereof, inside the Affordable Care Act's marketplace subsidies. Now, we're not here to debate the merits of the ACA itself. Our mission today is, much more specific. We're going to pull back the curtain on the incredible, just surging scale of fraud and waste that's happening right now. We'll extract the astonishing stats and then look at what's being done to try and clean up this mess.
And we have to start with the most immediate evidence, which is it's chilling, really. Your sources all point to a government watchdog, the GAO, which tested the system.
Right, the covert testing. And the numbers they found are, frankly, unbelievable.
They really are. The report showed that in late 2024, 100% of the fake applicants the investigators created were approved by the ACA marketplace.
100%. 100%. This wasn't some small glitch. It was a total collapse of the front door verification.
So the gate is just wide open. But I think the worst part is what happens next.
Precisely. The system keeps bleeding money. The same report confirmed that 90% of those same fake applicants are still receiving subsidized coverage right now in 2025.
So once the fraud gets in, it just stays in.
It stays in. The system struggles mightily to kick it out.
And when you put a price tag on that failure, the numbers are just catastrophic. What are we talking about in total?
The current estimate is $27 billion. That's what improper enrollment is costing taxpayers in 2025 alone.
$27 billion.
And that number is growing. It's up from $20 billion just last year. It's a ballooning crisis born from failed integrity controls.
Okay, so let's unpack this financial black hole. How did we get here? This is all tied to the premium subsidies, right? The APTCs.
Correct. The advanced premium tax credits. And the real explosion, I think, is linked to the enhanced subsidies that came out of the COVID era.
Those were supposed to be temporary.
They were. But if they were made permanent, we'd be looking at a cost of over $488 billion over 10 years.
That's a staggering amount of money. But the sources point to a specific incentive problem here, right? Especially for a certain income bracket.
Yes, and this is crucial. It's the people reporting income between 100% and 150% of the federal poverty level, the FPL.
Why is that group so important?
Because for them, the enhanced subsidies mean their plans are fully covered. It's essentially free health coverage.
So there's no skin in the game for the enrollee.
None. And that just turbocharges the incentive for, bad actors like unscrupulous brokers to sign up as many people as possible, fraudulently or not, just to get their commissions.
And while all this is happening, the insurance industry is doing quite well.
I'd say so. Health insurer stocks have surged 1,000% since the ACA was passed. That's 4 times the growth of the S&P 500.
So taxpayers are shouldering all the risk, and the corporations are reaping massive rewards.
That's certainly one way to look at it. But let's go back to that $27 billion number.
Right.
To really get a sense of the scale of that waste, think about this. $27 billion is enough to fully fund the National Institutes of Health for more than 6 months.
Wow. Putting it against the NIH budget really clarifies things. That's a huge opportunity cost.
It's massive, and we're talking about nearly 6.4 million people improperly enrolled this year. But the truly alarming part, for me, is the lack of accountability. It comes down to something called reconciliation.
Explain that for us, because it's a key detail.
Absolutely. So when you enroll, the government pays the insurer in advance based on your estimated income. Reconciliation is what's supposed to happen at tax time.
The IRS checks your real income against your estimate to settle up.
Exactly. You either get money back or you have to repay the excess subsidy. But an analysis for tax year 2023 found no evidence of reconciliation for over $21 billion in these advance payments.
$21 billion just vanished with no follow-up.
Paid out, and the IRS never verified eligibility, never confirmed they filed taxes, never held them accountable. It's a colossal failure of financial controls.
Which brings us to how specifically fraudsters are pulling this off. Let's get into the mechanics of the malpractice.
I mean, some of the examples from the GAO reports are just stunning. They prove really administrative negligence. Take SSN misuse.
Okay.
In 2023, a single Social Security number was used on applications for over 125 different insurance policies.
Wait, one SSN?
One. The sources note that single SSN accounted for the equivalent of 71 years of subsidized coverage. all claimed in a single year.
71 years. That's not a mistake. That's an industry.
It is, and it keeps happening. In 2024, nearly 68,000 SSNs were used to get more than 1 year's worth of coverage in a single plan year. The system just isn't checking in real time.
And it's not just identity theft. The system is even paying for people who are no longer with us.
Unbelievably, yes. $94 million in taxpayer subsidies were sent to insurers on behalf of deceased individuals. The money just keeps flowing.
All of this just reinforces what the GAO found in their test. They got coverage for fake people with no documentation. If that can happen, there are no controls left.
Which is why we have to look at the incentives. This isn't random. It's driven by clear financial motivation.
And that brings us back to the brokers and that 150% FPL bracket, the one with the free plans.
Exactly. Unscrupulous brokers and agents make big commissions from insurers for every person they sign up. With free plans, the volume of signups goes through the roof.
And we have hard data on that, right?
Oh, yes. In 2024, there were over 160,000 likely unauthorized plan changes made by brokers. That's clear, large-scale manipulation.
And what about the actual people affected?
Well, CMS, the agency in charge, got around 275,000 complaints in just 8 months last year, all from Americans saying they were enrolled in plans or had their plans switched without their consent.
Just so a broker could get a commission check.
That appears to be the motive. And the fraud gets locked in by a huge structural flaw. Automatic re-enrollment.
The autopilot setting.
That's a perfect way to put it. In 2025, 45% of all enrollees were automatically re-enrolled. So a fraudulent application from 1 year just gets perpetuated year after year.
That explains why 90% of those fake GAO applicants are still getting subsidies. The system just defaulted to keep paying.
It did. And you can even see this geographically. The problem is overwhelmingly concentrated in states that use the federal healthcare.gov exchange.
And there was that startling example from Florida.
Yes. In Florida, there are nearly 5 times as many enrollees claiming to be in that free coverage income bracket as there are actual residents who are eligible for it.
5 times? That's not a statistical anomaly. That's evidence of gaming the system.
It confirms that bad actors have flooded that specific bucket to maximize the payout.
So, with a $27 billion hole, the political pressure is on to fix this. And the current push is being framed as a direct response to past policies, right? Policies that prioritized enrollment numbers over everything else.
That's an accurate framing. The main legislative fix is a new law called the One Big Beautiful Bill Act, or OBBA. It works alongside new CMS rules to try and close these massive loopholes.
Okay, so let's walk through the big anti-fraud measures in this new law. They seem to target the structural failures we've been talking about.
The first, and maybe the most critical, is ending automatic re-enrollment. Starting in 2028, people have to actively verify their income and eligibility every single year.
So no more autopilot fraud.
Exactly. Second, it attacks the self-attestation loophole with new verification requirements. Exchanges will have to actually verify eligibility for tax credits before enrollment.
So you can't just say what your income is anymore.
Right. Third, they're trying to curb the year-round abuse by ending any-time enrollment for that key 100-150% FPL group. It's a targeted strike at where most of the fraud is happening.
And the fourth big change.
That's about financial accountability. They're getting rid of the caps on how much an individual will have to repay if they got too much in subsidies. It removes the incentive to lowball your income because you know you'll have to pay it all back.
So what's the projected impact of all these changes?
The financial benefit is expected to be massive. We're talking about a potential of $185 billion in savings for taxpayers. It could also slightly reduce premiums, about 0.6%.
But the politics of this are huge. The sources say the biggest single action to curb this would be to just let the enhanced subsidies expire altogether.
That's the multi-billion-dollar question, isn't it? Letting them expire would save a fortune. But the CBO estimates 4.2 million people could become uninsured. That's the political trade-off. Fiscal integrity versus coverage levels.
And even getting these basic reforms implemented is a fight. There's a court case involved.
There is, and it's critical. Many of the new anti-fraud rules from CMS were put on a nationwide hold by a U.S. district court in August of 2025.
So the law passed, but the ability to enforce it is paused.
It's paused. Key reforms are currently suspended because of these ongoing legal and political battles. The fight to protect taxpayer money is an active, contested struggle right now.
So, to sum this all up for you, the ACA marketplace is dealing with an estimated $27 billion in annual fraud. This was fueled by policies that, prioritized enrollment over verification, and it created huge incentives for bad actors and enriched insurers. Now, there's a big push to reform the system with the OBBBA, targeting things like automatic re-enrollment, but that whole effort is tied up in court.
And that leaves us with, I think, a final provocative thought. The one piece of accountability that seems to be missing here is for the corporations. If we know that unscrupulous brokers and big insurance companies are the ones receiving billions in these improper subsidies, and we know that taxpayers, not the companies, are left holding the bag, should Congress mandate that those brokers and insurers be held financially liable? Should they be forced to surrender commissions or even repay the improper subsidies they received? That, I think, is the measure of corporate accountability that needs to be debated next.